Welcome to Face Health Talk Show. माँ बनना हर औरत का सपना होता है। कुछ लोगों का सपना पूरा नहीं हो पाता। उन्हें निराश होने की ज़रूरत नहीं है। आज साइंस ने इतनी तरक्की कर ली है जिससे सबका सपना साकार हो सकता है। इसी विषय की जानकारी देने के लिए आज हमारे साथ डॉक्टर्स का पैनल जुड़ा है। But before we start, I would like to invite my co-host. He is pulmonary and critical care specialist and senior member COVID team, Dr. M.S. Kanwar from Indraprastha Apollo Hospital, one of the best hospitals in India. Hello, Dr. Kanwar. How
Thank
are
you,
you?
Rashmi. I'm great. And good to see you again.
Same here.
It's a pleasure to be on your show always. And today we are not talking about COVID. We are not talking about
Of
lung
course.
transplant. We are going to talk about a very important subject which has changed the life of so many families, so many couples. And I have two very experienced ladies with us. One is Dr. Nimmi Rastogi. She's a gynecologist. She runs her hospital, Sarthak Hospital, and she's actively involved with the IVF and then transferring patients to the IVF team. And we also have Dr. Rupali Goyal, who is my colleague in Apollo Hospital, and she is coordinator of the IVF. She is IVF specialist. Welcome to you both, Dr. Nimmi and Dr. Rupali.
Welcome.
Thank you, Dr. Kanwar. Thank you, Rashmi. Thanks for having us.
Thank you so much. I would actually like to thank you on behalf of our audience all over USA and Canada who are watching this show, of course. And everybody is curious to. They were eagerly waiting actually, for our show today कि कब होने वाला है और आज हमें कितनी जानकारी मिलने वाली है इस विषय के बारे में. So thank you so much for taking our time. Thanks a ton.
Yeah, and for Nimmi, it's not this channel is not new, and
Of
she
course.
has been on show. Nimmi, do you remember what was the subject when we discussed last time? This was, I think, Delhi disaster management program. In fact,
That was
Dr. Nimmi is a member of the Delhi government team, which advises the chief minister on the COVID preparedness and so a lot of other things. So we look at her not only from the eyes of a gynecologist, but also from an administrator in the Delhi government. Dr. Nimmi, I'll just start the proceedings. What is the incidence you think and extent of infertility in India?
okay. So coming to the point straight away, incidence of infertility is pretty high and it's on the rise. आप यकीन नहीं मानेंगे जब हम लोग when we were studying to be medical graduate, that time the incidence used to be much lower. So it used to be 10%. And over the years, as we are in OBGYN practice, you'll be surprised that it's gradually rising, and at the moment, it's somewhere between 5 to 15%. And there are regions when it is where it is as high as 20%. So out of every 5 to 6 women or couple, one couple struggles to conceive. So I should say it's on the rise.
What do you think is the reason for that? That the incidence is rising.
Lots of reasons. You name a reason, and that can be attributed to declining fertility in young couples. I think Dr. Rupali would like to elaborate more on that. But generally speaking, late marriage, environment pollution, stress of all kinds, and general factors like less than perfect lifestyle, and then smoking, alcohol, use of drugs, and now taken a toll on fertility. Apart from that, hormonal issues, polycystic ovarian syndrome, even male fertility is on decline. There are, sperm count in last 5 decades has fallen by 70%. So,
Okay.
lot of factors. And I guess Dr. Rupali would like to elaborate more on that.
So
Yeah,
very
Dr.
nicely
Rupali.
said. Dr. Nimmi, I would really say, yes, you are very right in saying one of the most important factors why infertility is on the rise is the age. More specifically, the age of the female partner. If you look around yourself, we people look around our own relatives, people don't want to get married early. They
Yeah.
don't want to get married till they're 30, 32, 35.
Yeah.
They don't want to have babies till, say, 4-5 years of marriage. And when they want a baby, they want it super fast. That's what era we are living in. So, which actually doesn't happen like that. So one of the most important, actually, we call it a prognostic factor. Prognostic factor means a factor by which we can say that yes, the chances of success are a little better in this age group, is the age of the female partner. Now, apart from that, yes, very rightly put forward, alcohol, smoking, the amount of air pollution, the amount of preservatives used, indeed, premature ovarian failure, yani ki jo the eggs which usually would decline at 40 years of age. Now, there is a higher incidence of the eggs declining or getting even completely over by 30 years of age.
Oh.
So that is really on the rise. If you look
So basically what you're saying is that advancing age is a problem.
It's a major problem. Apart from the lifestyle factors, the stress, type A personality, all of us all the women are more career oriented. They're into, obviously, yes, very rightly put forward as alcohol, drug abuse. And yes, in our country, we should not, at least being in India, we should never miss the, the last diagnosis of tuberculosis, which does play a significant role in our country.
Yeah, absolutely.
It's a
how important is, Dr. Nimmi, Dr. Nimmi, there is some disturbance. Dr. Nimmi, how important is counseling, and at what stage do you think counseling is required, encouraged?
So before that, I want to say that it's a paradox that on one end, girls are maturing early. So we are seeing puberty at the age of 9, 10 instead of 12 and 13. And then we are promoting our girls and says, go get a career, educate yourself. We don't emphasize upon marriage being so important. So by the time they have a suitable career, and by the time they decide to raise a family, it's already too late. At the age of 26, I mean, it takes a lot of heart for a woman to say, leave everything, make a baby. But that's too early for her other factors in life. So it's a big paradox.
Yeah, this is a very
sure.
common conversation in all the groups what she's talking, all age groups, they are definitely facing this problem. And we do had so many questions that same thing what they have started this gender today, that they don't want to get married till 30. And that's what they wanted to know. And of course, smoking is something which is they are very much habitual of because of a lot of stress in their life, and they have pressure from their family and they're not able to leave it. So they wanted to know that how can they come out of this problem, what should they do.
Yeah. In fact,
that is the place where counseling comes into important. That is the place where right time and right counseling comes as a very important. One of the unfortunate things is that in our country we do not have a proper, even a sex education kind of a class. That's number one. Number two, preconceptional counseling is very less, although it is improving, I would say. The number of patients who come for OPD is definitely improving. Here we can actually tell the couples that what is the right age, what is the right time, what are the prerequisites. Now that is very, very important. They should understand the importance of the right age, as I have previously also mentioned. That right age is a very, very important. Apart from the lifestyle factors, which we people are getting into, especially the affluent society. The incidence of polycystic ovarian syndrome is on the rise, and it is mainly a disease of the well-fed people, the affluent class people. So that again has to be counseled to the people, and they have to be made aware that yes, this could lead to fertility problems later on. This could lead to even a metabolic syndrome later on in life, and it has to be corrected at a much earlier time.
In urban India, I think the most important, one of the most important causes certainly is career orientation of women. So the marriage and getting childbirth is become secondary for them at some stage. Yeah. Um, what are the steps, Dr. Rupali, that the patient has to undergo? I mean, what is your normal routine? The patient comes for counseling, and what are the usual questions you ask, and what are the thoughts that go through your mind? Is it male-oriented or female-oriented problem? And then, what sort of investigation, how you sort of go about it?
So currently what I would say is still India is more of a male-oriented kind of a society. More so if you have some kind of a problem where we need to replace one of the gametes. Suppose there is a problem in the genetic composition of the baby, which has been detected because of previous abortions. There, obviously, the option would be replacing the female gamete. Female gamete means the eggs would be replaced as a first choice rather than the male partner's semen to be replaced. That is one thing. Rest, the treatment is very, very individualized. People are very hesitant still to go in for higher treatments like when we talk of an IVF, which as such is not very high if you think in terms of good outcome. When you talk of a good result, when you want to get a definitively good result, yes, the results of IVF would definitely be better than not giving them a treatment or giving them a very minor treatment. So it all varies with the patient who has already undergone a long treatment versus a patient who's just come new to us. And there are times when we actually have to tell them that yes, go in for a timed intercourse first. Even in the corporate world, even in the well-educated people, this is, as I mentioned previously, that lack of sex education, lack of teaching that subject in school, people are not aware of the right time to, to have intercourse, to have a baby. Can you imagine? So we have to tell them that, okay, this is the right time. First, you go back home, try for the right time so that you have a baby, rather than labeling yourself or getting stressed about infertility. I mean, that is. So that's another thing which is very important, which I think people should know about. Yeah.
Now, what investigations do you go for?
So our investigations would initially be, based on the patient. One of the initial investigations is always the male partner because his is the simplest investigation, doing a basic semen analysis. When you talk of the female partner, as I previously mentioned, there is the incidence of premature ovarian failure, which means that the eggs getting exhausted is really on the rise. So we try to assess the ovaries. Ovaries are the main female gamete, that is where the eggs are produced for the baby. Then we also try to test for the tubes, the tubal patency, that is the canal through where actual fertilization, the meeting of the egg and the sperm takes place, which happens in the tube. So that part has to be tested. The eggs have to be tested. And the third major test is the test of the uterus, the uterine lining. These are the three main heads we tested. We do test the hormones as well. But that is a second level thing. If the couple has not really had proper intercourse, we might, not even do it. Sometimes they just come to you with a 3 month of a trial, which is not right. Which is so 3 month of a trial, 4 month of a trial is not right that you start investigating them. That's the time we just counsel them. But yes, if needed, we do, investigate them in the first go if there is a pre-existing cause, which is obvious, like polycystic ovarian syndrome, etc. That kind of a picture.
And how do you do egg freezing?
So talking of egg freezing, it's actually a newer technique and I think a revolutionary method, more so for the career-oriented women who do not want to have babies, who do not want to have babies at an earlier age. The advantage of this procedure basically is to freeze your eggs, freeze your own genetic material so that it can be utilized, after whenever you are mentally ready to have a baby. As Dr. Nimmi was also pointing out, nowadays people don't want to have babies early. More so why should women suffer? It's also a part of now getting the debate is going towards gender equality actually. And I think yesterday's Times of India also showed this news about the actress Kajol's sister who got her eggs frozen at 39. I mean, at 39 is definitely a late age, I would say. But yes, egg freezing is a process by which we are actually doing an IVF kind of a process where we take out all the eggs from the female partner, put them in liquid nitrogen, and you can actually freeze it for 10 years also. I mean, however long you want. And later on, when you are mentally prepared, you're in a better place, mentally as well as psychologically, financially, you can at least use those eggs and have babies. That's one thing which is really upcoming all across the world. We also use this egg freezing phenomena for young girls who are undergoing cancer treatment.
Okay.
Am I audible?
Yes, you're audible, Dr. Rupali.
So we also use it for cancer treatment, more so when cancer treatment, the prognosis is really improved over the years. That is, the survival of young cancer patients has dramatically improved over the years. So in those patients, we suppose they're to undergo some kind of a chemotherapy or radiotherapy, which is involving the area of ovaries, a radiotherapy involving the area of ovaries, or chemotherapy when the drugs are gonadotoxic. That is, they're dangerous. They're dangerous either for the ovaries or even for the semen, for the sperms. So this is being done where we do a sperm freezing technique, which is more simpler, as well as an egg freezing technique can be done, and they can later on be free of cancer, get married, plan a baby, use those eggs, use the sperms which have been frozen, and have their own genetic material for the babies. That's what is used.
Dr. Rupali, I want to know how long does IVF take, like?
So the duration of IVF, although does vary with the patient profile, like what kind of a problem the patient has, but in most of the scenarios, it's just a 15 days duration when we give them injections daily, and the eggs are taken out 15 to 20 days maximum is the duration. So there is not a long protocol which is restricted to say almost only 5 to 10% of the patients. 90% of the patients would undergo a regular cycle where the duration of IVF cycle would be only say 15 to 20 days. After that, after the transfer, that is the process of IVF includes a pickup of the eggs and then a transfer inside the mother's womb, inside the mother's uterus. So after the pickup, they have to wait for another 15 days. Right, and most of the working women get back to work. They don't have to take a bed rest per se. They don't even have to take a big holiday to come for daily injections or anything. They can self-administer injections now. We've got they're like those insulin syringes, like the world across. Insulin is self-administered. So the hormones are also self-administered. They just have to come for 4-5 visits initially. So overall, it's become much more patient-friendly. Okay. And much more convenient for the patients to just come, say 4-5 times. You have to be admitted once for a duration of 6 hours, where we do a retrieval, where we take out the eggs. After that, another day when we transfer the eggs inside the uterus, and then they go back home. As such, no rest is required.
That's good to know. Dr. Rupali, one more question, like how do you know that you are a perfect fit candidate for IVF?
So there are indications for IVF, very rightly said. Not all patients require IVF. Indeed, when the patients are referred to us also in our clinics, in our OPDs, it's not that every patient who's referred to us undergoes an IVF. Depending upon the profile, that is the causes of infertility, we would initially like to treat them by giving them minor treatments, by giving them lesser stressful treatments. Although I would say that yes, the results of those lesser treatments would be slightly less, but if it happens, that's what getting the baby is what is required, right? At the end of the day, the patient should have a baby. So only 20 to 30% of patients would actually go for an IVF, and one of the commonest indication is tubal problems in those patients who previously undergone treatment, who've been diagnosed to have some kind of a problem in their fallopian tubes, or have problems of polycystic ovarian syndrome, or even have had a premature ovarian failure. What I would say is that now, with the advances in science, we do have a step ahead of most of the problems which we have. That is, if the patient's eggs are exhausted, we are doing donor IVFs. In case there's a problem with the uterine lining, which is like the end point, we can the patient can opt for surrogacy. The patient can opt for a donor's sperms, or at times we put an incision on the scrotum and take out the sperms.
Okay.
A testicular sperm retrieval is done. That through that an IVF can be done. Indeed, we have really gone way ahead, where we can actually use just one sperm. Only one sperm, one healthy, good motile sperm is only needed, by which you can do an intracytoplasmic sperm injection and even freeze it. Indeed, now recently there are papers where they've frozen a single sperm, just one single sperm, and utilized it in an IVF and had a baby,
Wow.
which is I think quite miraculous. When we talk of a normal sperm count being in millions, I mean that's what the normal usual cutoffs are.
But doctor, I have one more question. Is there any side effects of IVF?
So as such, IVF does not really have side effects. That is why we do keep on giving them injections after every 24 hours. We tell our patients that, okay, make it at the time, be particular about the timing. Yes, taking hormones in a fewer percentage of people can give rise to a little bit of nausea, a little bit of, tired, excessive fatigability. But once the pregnancy advances, it's like a normal pregnancy. And we have ourselves done normal deliveries for IVF patients. It's not that an IVF patient can't have a normal delivery. Once the pregnancy progresses, initially, yes, we do want to give them a little more of injections. But afterwards, after maybe 1.5, 2 months itself, they are like a normal pregnancy to be treated. Yes, a little high risk because it's a precious pregnancy. But when you talk in terms of complications in the pregnancy, it's like a normal pregnancy. So they can undergo a normal delivery. They don't always have to be a cesarean delivery. And like a normal pregnancy, they can develop the usual complications. It's not an over and above the normal pregnancy kind of.
Dr. Nimmi, what are your thoughts on that?
All right. Go ahead.
Yeah, I'm asking Dr. Nimmi also. I would like to have the maximum use of our doctors we can have for our viewers. Yeah, of course. Yeah.
So it's very well explained by Rupali, and I just would want to add that there is a bit of mysticism added, around IVF. That we are making babies in labs, and what the process is. Is it ethical? Is it expensive? Is it amenable? Is it affordable or something? But I should reiterate and reassure that IVF is a wonderful, wonderful procedure which is available in most part of the world, and that's not out of your pocket. It can easily be done. I'm sure no procedure has 100% success rate, so IVF also has its pitfall. But when a person is struggling with infertility, short of IVF also there are some medical management and procedures like intrauterine inoculation, and then comes the stage where we suggest IVF. So an infertile couple should consult a gynecologist for the options that are there in front of that couple. And couple counseling, as we say, is very, very important. Here, I would like to add 2-3 more points that if you're married for about 1 or 2 months, and if you are not conceived, you should not consider yourself infertile. Okay. Theoretically, 12 months of unprotected intercourse, and if you fail to conceive, then we consider you infertile. But if your age is little on the higher side, then we start investigating even after 6 to 8 months. So don't panic. Okay. 1-2 महीने में बच्चा नहीं ठहरता है. Give it some time. Give it yourself some leisure, and then approach the whole thing with the positive frame of mind. And don't link your fertility with your sexuality. Most people think मेरे बच्चा नहीं हो रहा है इसका मतलब मेरे अंदर कुछ कमी है. Yeah. No, it's not like that. Sexuality is different, fertility is different, and there's a great gender bias. People say कि बच्चा नहीं हो रहा है तो woman की वजह से नहीं हो रहा है. And in places like India, there's a huge gender bias. Yeah. They will always blame the woman, whereas masculine factor for fertility is also as important. As I told you, sperm concentration and is going down. So you should approach, there should be a holistic approach towards the problem, and we should not draw our own conclusions.
Good to know. That was very
Nimmi,
knowledgeable,
what
Dr.
is the
Kanwar.
success rate realistically in India?
Yes.
Success rate realistically in India, apart from the claims made by the top institutes, I think it's 35 to 38 to 40%, not more than that. But that's a very decent percentage to begin with.
And indeed, now I think because science is so well, internet and everything, technology is so well that anything which comes up across the world, it just comes to India, and we are all very actively doing it. We're all very active in our literature and guidelines. So that thing is, especially because of internet, everything is really improved. So we are like at par with any other country, across the globe. That's the best thing about it.
So true.
So,
And Dr. Nimmi, what is the cost involved? Total cost
Okay, so
involved in everything.
cost-wise, India is a wonderful place to be. I mean, cost-wise, it's not even 1/5 or 1/7 of what the global cost is stated at. There are places where there are, of course, government hospitals, but not doing it too much. Mostly it is in the private sector. And I would say something like 2.5 to 3,000 USD to 8,000 USD. You cover everything from the best, from the basic IVF to ICSI to surrogacy, something like 10 lakhs to 12 lakhs INR. That's the upper limit. You can have, it's affordable given, global cost is very, very high, but India, it's economical.
Yes, very, very rightly said. Even like premier institutes like our hospital, Indraprastha, Apollo Hospital, the packages are very reasonable. I mean, although a little bit would vary according to the patient profile, the health of the patient, the age of the patient. So overall itself, if you want to, anybody wants to go in for an egg freezing, we can do it within 1.5 lakh INR, which is very good, I think.
Yeah.
And an IVF cycle also would cost you approximately this much, only to maximum, say 2 lakhs. At times, maybe with the donor, we could add another 1 lakh or say 1,500 USD more. That is what can be added. But yes, surrogacy is slightly more expensive. That's, I think, the last of the spectrum where, as very rightly put by Dr. Nimmi, it's around 10 to 12 lakhs. But other things are very, very reasonable. I would say spending 1.5 lakhs for freezing your genetic material is definitely a good alternative when we talk in terms of career-oriented women, where it's a good thing. It's a good option where you can just freeze your eggs. That way at the right age. Now that the age factor is very, very important. Why? Because people wake up much later. And that is the time when the age is gone.
So true.
As I just mentioned, 39 years is much later. Even the ASRM, the American Society of Reproductive Medicine, says that the right age of egg freezing is late 20s and early 30s.
Oh, okay.
So which is actually, which I think people are not aware of.
Yes, they are not aware of it. Of course.
Yeah, people are not aware of it. So they do not even bother to think about it. By the time they're like this Tanisha Mukherjee actress, by the time they're 39, they think of it, but 39 is not a very ideal age to freeze it. Although, yes, I mean, something's better than nothing, but no, it's not the ideal age. It's much later than the ideal age. World across, even if you type it on something like a Google, they'll tell you that the age of success rate, the cutoff of success rates of IVF is 35 years, beyond which the success rates of all the IVF as well as infertility procedures start declining, that is, they start falling. So it's like a wake-up thing, more so in the Indian continent, where our pollution, our lifestyle factors are again more detrimental as compared to the international standards. So that's again an important thing.
We can go to India.
Dr. Kanwar, I don't think so she's able to hear you. Come up again.
Dr. Nimmi, can foreigners travel to India for IVF? Because there is cost advantage. No question about that.
No, there has been change in rule in surrogacy laws in India. And details. It will take another program for me to elaborate upon the entire spectrum. But foreigners for surrogacy is not allowed now in India.
Oh, really?
There's a bill.
Oh, okay.
There have been changes in the rule in 2020 only, and the bill has been passed by Indian Parliament. So now the rules are much different as they used to be in 2000 till 2019.
Oh, okay. Actually, today's session is very informative, I should say, and in such a short time, you have shared all your knowledge. That's what I'll say, and it will be such a great benefit for our viewers. It's great, actually. So, anyone who is traveling from US or Canada, if they want to be in India, so how long do you think they have to stay in India if they come for their treatment?
So usually we tell them to come here for say around 20 days, the bare minimum. But that 20 days, the first day would be the first day of period.
Okay.
I mean, our treatments are all based on periods. It's not like a calendar month. So if they can arrange it like that, if they can arrange their visit according to their periods, whenever the expected periods are, 20 days is bare minimum which is required for them to stay here. I mean, at our hospital, we do get few foreign patients, few people from outside, but that's what the usual counseling is. So a regular IVF, yes, even the outsiders, foreigners can undergo, but surrogacy is a big, big no, as mentioned by Dr. Nimmi. Yes. So.
Uh, and we know that the IVF babies are equally healthy. Is there any doubt about that?
Absolutely no doubt. They're equally healthy. The pregnancies would be equally normal. They can undergo normal deliveries, as I previously also mentioned. We have been doing it. So they're very healthy. There is no doubt about it.
Well, even my daughter had IVF babies.
Okay.
And fantastic babies, both of them. They're about 18, 19 months old now. So they're doing well. So that's well, Rashmi, I think it was a great sure people would have benefited from all that. Dr. Nimmi, any message you want to give to the audience?
The only message will be, girls and boys, if you're thinking of raising a family later on, please start early rather than late, and don't wait forever. Have a plan ready, live healthy, though it's not be all and end all of your existence that you have a baby later on, but if you're thinking of raising a family, don't put it on the back burner. Have a plan ready, and have a good lifestyle, because your sperm and egg, these are cells. So aging affects your sperms and your eggs. So your general health will reflect upon your reproductive health. So rather than, and IVFs and fertility treatments are not magic wand. All the cases cannot be treated by the treatment options available. So there is nothing like having a natural pregnancy or by natural process. But we have many treatment modalities for those who are struggling with their fertility. But the message is, live healthy and start early.
Thank you so much. Thank you so much.
Dr. Rupali, your message, please.
Yes, very nicely put. So age is very important factor. The clock is ticking for everyone. Just remember that, just remember the later you go in for any of these procedures, the success rate is going to be a little lesser as compared to at an earlier age. So as very rightly put forward, have a plan. Just think about it. In case, there are lots of couples who don't want babies nowadays. So that's also all right. But in case you want to have it, in case you think you might want to have it, please do. People are coming forward, I would say. People, please do it at the right age and, at the right time. Definitely live a healthy lifestyle. There is no compromise. There is no nothing on that. Nothing is foolproof. We cannot be 100% sure even with an IVF. And yes, we do try for smaller things first, then only take them up for an IVF. That's about it.
Well,
Thank you so much,
Rashmi,
Dr.
any
Rupali.
questions from you or from the audience?
It was great actually, and of course, it's a short span of time today, and we couldn't take our calls from our viewers. But of course, they can connect with Dr. Nimmi and Dr. Rupali, of course, and they can of course call their studio 732791646. We'll definitely connect you with all our doctors, and of course, it's like an awakening call, I'll say, for all our viewers, and it's a beautiful message from Dr. Nimi and Dr. Rupali, I'll say. So now they'll start thinking about that this is the time and you should take care of your age. Your number is really important. So just don't go on with the flow. Of course, your career is very important, but everything, कहते हैं ना सही वक्त पे सही काम होना बहुत जरूरी. That's what the message is all about. So thank you, Dr. Nimi. Thank you, Dr. Rupali, and thank you, Dr. Kanwar. Your message for our viewers is also very important, Dr. Kanwar. Before we end the show.
Well, my message is to you, Rashmi. If you go on arranging fashion shows every month, then the girls will keep postponing their IVF, their pregnancy anyway. So you should, first of all, you should be counseled to go slow on that.
I'll take care of that, Dr. Kanwar, and will of course give the message that of course take care of your age. And Dr. Nimi and Dr. Rupali, we are waiting for registration for our upcoming pageant, My Dream Miss World 2021. Looking forward to see you both on the ramp. Thank you so much, Doctor. And it was a great show.
And I'll remind.
It was so nice.
And I'll remind both of them to register. I'll send them the link.
Sure. All right. Thanks a lot. Thank you for this.
Thank you.
Thank you.
Thank you, Rashmi.
Thank you very much.
All right. Bye.
Thank you.
Dr. Nimmi. Bye-bye.